Okay, well, hello, People's Health Alliance again. I'm once again delighted to be joined by Rob Jardine up in the north of Scotland, where it's winter's arrived again. Hi, Rob. So I'm Graham Atkinson. I'm in the northwest of England, not quite as cold as Rob, and hopefully our internet will hold up for you. So this is our second video on the topic of German new medicine. So we'd recorded about a month ago now our first discussion where Rob introduced the paradigm of German new medicine, which is really quite different if you've not come across it before. So what we're going to do today is go into a bit more detail um, and talk about specifics with some more enlightening examples. So if you haven't watched the first video, I think we'd suggest you go back and watch that one first because it will give you the context and the introduction to what is really quite a different way of thinking. So we've already had some great comments come in to the PHA. So thank you for your feedback. Please keep that coming. And without any further delay, I'll welcome Rob and say thanks for joining us again.
Hi, Graham, and hi, PHA. Hope it's all going splendid. Um, I'm up here. We were snow last night, so I'm speaking to you from the outposts in the Highlands. We can only go another 3 miles north, and then you're in the North Sea, so we're right at the top. And I'm so delighted to have been asked back to do a little bit more talking about Dr. Hammer's discoveries, German new medicine. And we've done a video already, so that's really sets the foundations of what I'm going to say today. So today's going to be a bit of a leap into the shallow end of the pool, if you know what I mean. We're getting out of the paddling pool and we're actually going to jump into the shallow end of the pool. So don't worry, it's not going to be too technical, but there is going to be some drawings and diagrams I'm going to attempt to put a little PowerPoint presentation on. And all I would say is that it is a complete paradigm shift in our understanding of disease and the human experience. And it might take a few watches for it to sort of settle in and find its truth within you. Um, Obviously not you, Graham, because you know it's true, and you've seen it from the inside and out and the outside in. So yeah, but lots of other people that they need a little bit of it. There's a lot of cognitive dissonance to overcome, I think, because we've had a lifetime of training, thinking of one way of health, and now somebody's come up with a discovery which is objectively provable in every case, but nevertheless, it's a bit of a chew. Um, so I think what will I do? Will I just start talking about my
Yeah,
show
I
now?
mean, yeah, I mean, we can either go straight to the illustrations or I mean, I think what I can maybe just briefly talk about my experience, in terms of, learning
Mm.
German medicine, because I trained as a pharmacist. I trained in the allopathic Western healthcare system, and um, for many, many years, I really believed I knew what health was and what healthcare was, and I was doing the right things. But my sort of 30 years in the English NHS showed me that much of what I was doing actually doesn't work. And I think that's probably the sort of realization a lot of people come to is they try what they're told and they follow the guidance and they take the tablets, they go and see the doctor and they follow the public health advice, but it stops working at a point and life catches up with you, your stresses and traumas start manifesting different conditions and you don't get any answers from the system. The Western healthcare system, I mean, I view it now as simply reducing or trying to eliminate symptoms. It doesn't deal with the root cause. It never wants to address the root cause. It doesn't understand the root cause. And clinicians, if you ask them to think about what could be the root cause, they look blankly at you. It's just not in their training or their nature to think about that. And the massively empowering and enlightening thing for me about German new medicine is that we're actually understanding the root cause of our symptoms and our diseases, and then we're empowered to actually heal them ourselves. And that's the other revelation is the healing is within us. It's already within us. And we
Mhm.
just have to understand that and get out of the way and let our body get on with the healing programs that Dr. Hammer identified. So I just share with that with my own passion, and I'm still learning every day. Rob and I had a chat recently because I've got some symptoms that I'm managing at the minute, and Rob helped me understand the genesis of those symptoms and the circumstances that gave rise to those symptoms, which was news to me, even though I've been thinking about this for many years. So we never stop learning. So, every day is fascinating for me. So I just love these conversations we're having. Um, so hopefully that's helpful. Just sets the scene. So I think it's as much about unlearning what we think we know, and setting aside your beliefs, and what and being open to new information. And that's the sort of essential bit I would say about taking in this great information that Rob's going to tell us about today. So I'll say, so I understand, Rob, you've got a recent example of a patient that you'd like to talk to us about. And the key thing here was understanding the date when the symptoms started, and then helping the client realize the events that they were going through at that time that generated the symptoms. Is that right?
Yeah. Yeah, yes. So, so a client that I had recently, she got to me eventually, and she was losing a lot of her hair. It would become quite thin by the time I started working with her. And what we did a process of finding out the moment as accurately as we possibly could that had caused the emotional trigger, which had created a feeling of separation within her with her partner over a life issue. And our hair had when we time track back, we've discovered that our hair had actually started to fall out very soon after that. Within about a week, less than a week, in fact, the hair started to fall out more than she'd expected. So, it when we went through the sort of a G&M process, we were able to find a life event which was responsible for a physical symptom of the girl's hair falling out. And we resolved that conflict as best we could, both practically, and you did therapy on it as well. And when uh, once her psyche had overcome its issue, the hair obviously grew back fully, and that was a good result for us. So it's really just an example of how our bodies are connected to our lives via our psyche.
Yeah.
So yeah, so that's a kind of good happy ending example. But I must say, this process applies to all forms of disease.
Yeah.
So the detail changes depending on the type of trauma and such we experience, but nevertheless, the overall message here is that if we have a, a, a symptom of some type, it will be being controlled by the body via the psyche, by the brain,
Mhm.
and it will be connected to or tracking a life issue that we have experienced.
Yeah.
So,
Beautiful. I
yeah.
mean, there's a sort of revelation I've had quite recently, Rob, is that looking back on my training, in the allopathic system, I was trained that the mind is a product of the
Yeah.
body. That
Hmm.
our body has a brain, and my thoughts and my emotions are inside my brain. And I no longer see that to be the case. I actually
Hmm.
see it the other way around now, that our body is the product of our mind and our soul and our psyche. Is that how you see it?
Well, I see it the way I see it is that um, our our mind is a recent download, as if you look on this time scale of evolution. But long before or as our bodies evolved, so did our psyche. So the psyche is the biological brain, and it's part and parcel of the body. It controls everything in the body, um, for better or worse. And more recently, we've evolved a mind which has now become so in on itself that it doesn't realize that it doesn't realize that the mind is just a part of the bigger scheme of things. Um, I my analogy which I use with clients is that it's like a basket of eggs, right? The eggs, there's maybe two eggs or three eggs in the basket, and one of those eggs is your conscious mind, and the other eggs are your unconscious and your very unconscious mind. But the basket which holds it is the psyche, and it's always there. And part of the healing process is to for the conscious egg, the egg that's got the conscious part of the mind in it, to realize it's sitting in a basket, and its well-being and its continuation depends entirely on what that basket does. If that basket tips over, the egg's going to fall out and break, and that's the end of the game, you know. So it's
Yeah.
best to play the game of the basket and make sure the basket stays nice and steady.
Right. Well, that's great. Yeah. So it's yeah. It's like we say, every day's a school day, and I thought I'd just when you think you might be beginning to understand something,
Yeah.
you realize there's another level as always. So thank you. That's beautiful.
Yeah.
Um,
Thanks.
right. So I mean, do you want to? I mean, you've got some graph
Yeah.
you can share. Do you want to get into that now, and we can discuss as we go along? Yeah.
Yeah. Yeah, definitely. So I'm going to screen share, and that was just screen share, and I go to there. I'm no expert at this. Okay, so I'm doing my best for everyone. Stick with me. So this is my little presentation which I've done for this today. There's a little bit of detail in it, but please don't be overcome by the detail, because you can always watch it again. So a few power statements to start with. So German new medicine. Let's see what happens if I press this. So hopefully something will. Oops. For some reason, it's not working now, Graham. Oh, yes, here we go. Right. So German new medicine, it shows to us that all symptoms of disease, big or small, are manifest through a biological adaptive process, which is always initiated by an emotional trauma. This biological adaptive process is governed by 5 biological laws which are at play in every case. No matter what the symptom is, it will be controlled by these 5 biological laws if it's manifesting within your body. All diseases can be seen being processed through the brain as it deals with the emotional conflict which the brain is processing. When this happens, it is visible in the brain using CT scanning. All diseases are symptoms of a biological adaptive process which is trying to help us overcome the emotional conflict which we experience in life. It's trying to help us overcome it biologically, if you like, from a prehistoric perspective. The disease process is orchestrated by our psyche, which is our primitive biological brain. As I said to Graham, it's the basket that holds the eggs, and it's sitting on the table, and the table's the body. So the psyche's in commune, is if you like, is in contact and controlling the body. We share this process with all other creatures. So it's not just us, it's our pet dog and their pet hamster, and even things as low as insects and such. It's all the same. The same process is going on. Obviously, insects and lower forms of life have a more primitive brain, but nevertheless, the process in principle it continues right down to that. And even, and as Dr. Hammer teaches us, even in plants to some degree. Every detail within German new medicine and how it predicts the processes of disease can be objectively proven in every single case. and this is my personal opinion here, I believe it to be the most significant scientific discovery in the history of science and the most important for humanity in these times presently. And at the end of the day, this knowledge gives us control over our health and it frees us from the fear of disease. So let's have a deeper look. Oh, what have I done here? Right. This picture is of a graph. Roughly speaking, it's a two-phase process. There's the blue side and the red side. So let's just have a look at something, a little bit of history. Now, this is called embryology, the science of looking at our development from conception up to birth. And this diagram shows, Graham, can you see my cursor there? Yeah. Okay, so this diagram shows that there's a picture of the brain. There's the brainstem. There's the neocortex and such of the brain. There's this three little babies all curled up there. Shows the lower one shows the digestive system, or which is made of endodermal cells. The middle one is the mesodermal tissue, and the topper one is the ectodermal tissue, which is your skins. Okay, so about 12 days after conception, we form this kind of organism here, where the cell types are divided, and they can be clearly seen as three different cell types within the developing blastocyte, or I'm not sure because of fetus then or not, but anyway. So the lower level here, which are colored yellow, are endodermal cells. The middle layer are mesodermal cells, and the top layer are ectodermal cells. Now, from that time on, as the body divides, these cells divide and organs become formed, and we eventually, 9 months later, we end up as being a little baby born out of our mum. What happens? The process is that the endodermal cells at the bottom go on to form all of the endodermal tissue in the body, which primarily is in the digestive system. But Dr. Hammer also has shown us that these endodermal cells also go on to form the brainstem. Isn't that interesting? And likewise, the mesodermal tissue goes on to form, one of the things it forms is a skeleton and the skeletal tissue and everything that's associated with the skeleton. But it also goes on to form the cerebral medulla. And the old mesoderm goes on to form the cerebellum. Okay, so it goes on to form those brain parts as well. The same is true for the ectodermal tissue, as in the ectodermal tissue here goes on to form all of the skins. So it's the skin that you can see and that you rub your Nivea cream on, but also that skin tissue is also in the body as well. So it's, for example, in the female lining of the female breast ducts is ectodermal tissue, or in the small curvature of the stomach is ectodermal tissue. So that tissue also goes on to form the neocortex of the brain, which is the part of the brain that we know when we see pictures of a brain. That's the outside that we look at. But what Dr. Hammer also discovered is that these parts of the brain control those tissues from that point going forward. So that's a very, very important point, that any symptom that you have, or anybody that you know has, including your pets, the tissue type is that symptom within that tissue is being controlled by the associative part of the brain. Now, this picture just kind of reaffirms that. The cortex is controlled, or your skin is controlled, the ectodermal skin is controlled by the cortex. The skeletal tissue and everything associated to it or connected with it is controlled by the cerebral medulla. The corium skin, so that's your peritoneum or your pericardium, is controlled by the cerebellum. And the digestive system and endodermal tissue, there's also endodermal tissue in the lungs and the breasts and other places as well. But nevertheless, it's all controlled by the brainstem. And therefore, every disease in each respective body part is controlled by that part of the brain and can be seen doing so using CT scans. Now, this graph, I'm going to try and do something here which I perhaps might regret. I'm going to go pen, and I'm going to try and draw on this screen. Now, this graph represents the function of the body from the perspective of your autonomic nervous system. Now, so everybody knows what that is. The autonomic nervous system is the unconscious automatic nervous system which controls the body, controls everything that goes on in the body, apart from the things that we consciously control. Okay, I can lift my finger up, or I can lift my hand up, I can stand up and walk. That's conscious. But everything else the body's doing is controlled by the autonomic nervous system. It's got two branches. It's got the sympathetic branch and the vagatonic branch. It's like day and night, or rest and digest, as opposed to fight or flight. People often talk about it. It normally follows a normal 24-hour rhythm where during the day it's the sympathetic branch is active, and then at night time the vagatonic branch is active, and it follows this sine wave pattern, this day-night pattern of autonomic control of the body. So during the day we go out and hunt and gather and do day things, and at night we digest and rest and recuperate. That's the way the body works. But Dr. Hammer also discovered that if we experience a trauma that affects us biologically, then it interrupts this process, this control process. And here represents that triangle there represents a trauma that somebody would have had. Now you can see that after that trauma, this day-night rhythm is interrupted to some degree. And it stays that way until the conflict which was entered into your life in the moment of that trauma, until this conflict is resolved here. Okay. And then we enter this double dip with the red and then the blue spike in the middle, and the second red dip. This is a healing, what Dr. Hammer calls a healing reaction. So the first phase is the body adaptive phase, and the second phase is the healing the healing phase. Now, this graph in principle is the underpinning foundations of all symptoms. Any symptoms we develop in the body, call it medical symptoms or health symptoms, doesn't matter, will be caused by some part of this graph. So let's move on to this graph here. Now you can see that this is the same graph underneath, but with the information on top superimposed on top. So I'm just going to talk you through how we become ill, so to speak. Okay. Normal day-night rhythms going on. You know, your average life is just, you get up in the day, you go to work, you come home, have your dinner, eventually watch TV or something, or delve in the internet for a while, then go to bed, then you wake up, and on it goes, right? Then let's say you get a letter saying there's been some mistake and your bank account's been emptied, and that's very traumatic to you because it wasn't you that emptied it, right? So right, so it's like, oh my God, I was on eBay, and heaven's sake, I knew I shouldn't have bought that thing, or whatever, right? I'm doing a miscall eBay, but do you know what I mean? We can easily get diddled these days with all this technology, right? So that could be one example. Now, if it's a big trauma, it upsets the autonomic nervous system, and then this graph shows that then we get resolution to the issue there, and then we go into healing. So if the psyche, which is the biological brain, processes that trauma through the brainstem of the brain, what actually happens is when we have the trauma, the brainstem, or whichever part of the endodermal tissue in the body the brainstem decides is most appropriate, cells start to proliferate, and we start to develop an adeno cell growth. Can be called cancer. It can be called an adeno cell growth. Cancer is a scary word until you understand German medicine, then it's not scary at all. But anyway, so what happens is we suffer the conflict, and the brainstem, if it's been processed through the brainstem, the brainstem starts to increase the number of cells somewhere, most likely in the digestive system. This continues until we get resolution and we get all our money back, and then we start to feel unwell, and we start to run a temperature, and we may even start to sweat at night, and our hands and our body warms up. And eventually we get through this healing phase, and then we get back to normal, which is marked here. That's back to normal there. So what's happening is that when we experience a life trauma and the psyche processes it through the brainstem, it affects the yellow cells, which primarily are in the digestive system, but not only. And a process starts, and it runs for as long as that stress is unresolved. When we resolve that stress, the body goes into a predetermined healing phase, and should we get through that successfully, everything gets back to normal. So that, in principle, is that's a major discovery that Dr. Hammer has given us there, that the brain has perceived, or the psyche has perceived a life trauma. It has processed it in some part of itself, of the brain, and then it starts a predetermined biological adaptive process to try and help us overcome that life trauma biologically. Now, what I've said there for the endodermal cells, which are the yellow cells, is the exact same truth applies to, let's say, the ectodermal cells, which are the red area of the brain. The only difference is that when the conflict starts here, instead of cell augmentation, what we get is cell loss. And when we resolve the conflict here, instead of previously there was cell loss got where the so-called cancer got rid of itself, with ectodermal cells, we have cell proliferation. So for example, here you get dry skin happening, and here you get eczema happening. Okay, whereas here you have a bowel cancer developing, and here you have tubercular bacteria removing that bowel cancer, and you're sweating buckets every night. Both are biological processes aimed at helping us overcome a life issue, and when the life issue is overcome, the body goes into an automatic healing process. So Dr. Hammer's work shows us that disease isn't random. We don't catch it. It's not infectious. That we develop it as a reaction to life. And that's the big overall issue that I want to, for this slide to get out to everyone, is that it's not random. Microorganisms such as bacteria are actually within the body, and they are being controlled by the body, and the body actually uses them when the conflict is resolved, and it uses them to help reestablish homeostasis and normal function of the body. There's just a diagram of a part of it again, and I just wanted to talk about some examples. Now, you can see that I've given this a yellow outline, which indicates that it's endodermal cells run from the brainstem, so therefore it's going to go through that cell process there. The trauma happens here, okay. The liver parenchyma cancer starts to develop in here. When the starvation conflict is resolved, because that's what causes liver parenchymal cancer, when that's resolved here, we then go into this phase here where we sweat the cancer out because the tubercular bacteria are removing it. And at the end of that process, we're back to normal again as best we can be. And we can see that I've got lung cancer written down there too, and inflammatory intestine conditions such as Crohn's disease. So Dr. Hammer, part of his, how can I get rid of those? And let me get rid of this back. And I think I can get rid of erase inks. Is that right? Yeah. So Dr. Hammer, his big discovery was using CT scans of the brain, and he scans his brain at an unusual angle, which is technically speaking, it's parallel to the cranial base. most times if you get a CT scan, you're just lying flat on the CT scanner as you slide in and out. Whereas with using Dr. Hammer's understandings, we have to jack the head forward about 15 degrees so that the scans are parallel to the cranial base. And this slide is a slide of somebody with developing liver cancer. In fact, this person has two relays active, two conflicts active in the liver cancer. So for looking at that slide, we can, if you understand slides somewhat, you know that that's the brain stem, that this dark patch in the middle here is called the fourth ventricle, which is like a sort of a cardinal point that you can reference things from. So that's the fourth ventricle, that's the brain stem, and though that is the relay for the liver. So just looking at that slide, you can tell that that person is developing adeno cancer in the liver. And from Dr. Hammer's work, we also know that they have suffered a starvation conflict. Now, that is incredibly important if you want to survive that condition and overcome it. Because at the end of the day, if you can figure out what that conflict is, which you almost certainly will be able to do quite easily with something as big as cancer, then if you resolve that conflict, then the body will automatically get rid of that cancer all by itself, which is big news. And this slide looks similar, but it's actually the relay, which is marked, the center of it's about there, and that's the relay for lung cancer. So again, lung cancer is the most commonly diagnosed secondary cancer, but Dr. Hammer's work strongly suggests that, in fact, he's on record as saying that his opinion is that most secondary lung cancers are caused by the trauma of the diagnosis of the primary cancer, because it transpires that it is a death fright that always triggers a lung cancer, a death fright. That is to say, the body is trying to help us breathe longer. It's creating more adeno cells within the alveoli of the lungs. And the alveoli of the lungs is where oxygen diffuses through into the blood and carbon dioxide diffuses out of the blood and we exhale it from the lungs. So from a biological perspective, to increase the number of alveoli cells increases our ability to breathe longer, which was our biological attempt to keep us alive that little bit longer, which makes a lot of sense when you look at it from a biological perspective. And this little diagram just shows, it's a blow-up diagram of the brainstem, and it shows all the relays that have now been discovered and what they relate to. So, for example, there is the lung that we talked about, the lung cancer. There's the liver cancer, and there, the one that's marked there as the sort of target is the small intestine. Goes through to the large intestine over here, okay, and then right down to the rectum and eventually finishes its process, which goes to the left side of the gullet. So, for example, the target ring, that really would be expected or would definitely need to be activated if somebody had, say, Crohn's disease or inflammatory bowel condition, something like that. That's the cause of it, and it's an indigestible morsel conflict. So somebody with Crohn's disease, now I see a lot of people with this or similar conditions. It might be called lots of things, but at the end of the day, if there's inflammation in small intestines, that really has to be involved. And the person is emotionally trying to digest a life issue which is troubling them, an indigestible morsel that they just can't resolve. They can't reconcile them to it. And as soon as they do find it through the process, the German new medicine process, and how we look at the timing of the symptoms and such, as soon as you identify that life issue and resolve it, the body goes into healing that night, and you will start your healing process almost instantly. And should you get through that successfully, which you definitely will with Crohn's disease, at the end of it, your inflammatory bowel disorder will be gone, and you will be free of it, and that's a good thing. So let me get rid of those, erase them. And there's just an interesting picture of the inside of an intestine. One is nice and pink on the left, and one is inflamed and red on the right. And um, nice and pink is a normal intestine where that person has not got an indigestible morsel conflict running. But the one, so that's on the left, and the one on the right is looking at the inside of somebody with, say, Crohn's disease, and they'll be going through an inflammatory phase at the moment. Now, the way we need to look at this from a German new medicine perspective is that digestive tract is trying to digest something in life that happened externally. It's no longer a morsel of food that's stuck in the digestive system, which it would have been millions of years ago. Nowadays, because we've got this conscious, complex mind, this ego, we can't digest life issues. And that's what gets, if you like, stuck in our gut. But the body has only got one way of dealing with that, and that's this biological process. And consequently, the road to recovering these or recovering from these conditions is to figure out what it is your body's trying to digest, and then do it for it. Resolve, if you like, resolve the issue for the sake of your psyche, so your psyche can let go of its biological attempt to resolve it. This is a different part of the brain, new mesoderm, ovaries. Thought there might be a lot of ladies watching this. So I would, again, it is a procreation type or a gender type conflict that affects the ovaries. They're governed from the cerebral medulla, which is here. They run through this pathway, which is here. And when the conflict is, after the conflict starts and before it's resolved, there is necrosis of ovarian tissue. On the point of resolution, oops, what have I done? On the point of resolution, the ovary starts to grow a cyst, starting here, and this cyst attaches to everything and anything that it can get a blood supply from to support its development. But after 9 months, so if you like, the gestation period of an ovarian cyst is 9 months, same as all cysts. And at the end of somewhere in about 6, 8, 7 months or 6 months, the invasive cyst detaches from everything and forms an integral part of the ovary, which that's the brain relay of an ovarian cyst, and there is a developing ovarian cyst. So that was a picture of one. It's not a picture. It's not a photograph, obviously, but it's a good picture. Eventually, that cyst will indurate, and it will form, if you like, an extension to the ovary, and it will produce an abundance of estrogen. Its purpose is to make the woman more attractive and more fertile, and that is facilitated through the much increased level of estrogen, which she will then be able to produce. So it has a biological purpose. That's the process, but nevertheless, it has been initiated by a life event, which is the real big take home that we need to get familiar with. That diagram just shows pictures of the skeleton and where it's controlled from the brain. So if you've got lordosis or kyphosis or something like that happening in your spine, you will be able to see the relays active in the relative parts of the spine there. And there's a picture of that same condition. But if we look at it, every part of the spine, even the teeth, so we always used to think that we would get tooth rot because we didn't brush our teeth often enough and we ate too many sweeties. But what Dr. Hammer has shown us, unquestionably, is that it's actually a biological life conflict which causes tooth decay. And it can be seen doing it through the CT scans. And those relays there are diabetes and hypoglycemia. That's where they're controlled from. So it's all. I think there was well in excess of 50,000 case histories in his portfolio on his death. When Dr. Hammer eventually died, and his record of accuracy of the brain scan and be able to determine what's going on and the life conflict which is connecting to it, the level of accuracy was 100%. It wasn't wrong a single time, which is quite some statement to make. So there's the lady with the spine issue. There's somebody with developing, let me get rid of that blue circle. Where's that? Erase the ink. Right. So there will be some of that will be a bone cancer in some young person they're developing. Again, it's the same. It's a biological reaction to a life issue. And I thought this was an interesting one. That's a picture of somebody with a big toe with gout. Now, gout's included this because it shows the interaction between life traumas, because gout is caused by two life traumas working at the same time. One of those life traumas is a self-devaluation conflict which is affecting the bone, and the other is a refugee conflict or an abandonment or existence conflict. It's got 3 or 4 names, this, where we feel like we've been abandoned, or we're like a refugee, or we've been left out, or we've been given the cold shoulder, if you like, from our pack or our family or our work colleagues, for example. And what that does is, and it's a very, very common problem, that it actually closes the kidneys and stops them excreting urine. So you get kidney failure to some degree. And because this person here has the bone program running in healing, the bone is creating a lot of uric acid. The kidneys don't excrete it because that person is running an existence conflict or a refugee conflict. So therefore, the uric acid isn't getting peed out. So that therefore it forms crystals in the joint affected, and they have extreme pain, and it's called gout. So that just shows the interaction between one thing that the psyche's doing, which is fixing the toe, and the other thing the psyche's doing, which is closing the kidneys because it feels that they're abandoned. And those two things are interacting, creating a nasty problem, which is a big part of health. It's something we have to deal with, and it takes us a bit of a higher level of understanding German new medicine to sort these problems out. But nevertheless, it's entirely doable if you know what you're doing. Ectodermal tissue, it's the same. That's the skin. I'm not sure what's going to come up here. Oh yeah. So ectodermal tissue lines the nose, and when that conflict goes into conflict active, let me go back one there, I think. When that tissue goes conflict active, we have cell loss in the nose. And when that life issue, which is a stink conflict or something that we don't like, something that we're suspicious of, something that we feel uncomfortable with, when that goes into resolution, we get a common cold. And if it's a big stink conflict, let's say like we really don't like our work or we really don't like school, and when we go in on holiday and we think our psyche goes, oh, thank God for that, we're gonna don't have to go back to that place for another 3 weeks. We go into healing, boom, out you come. You get a flu, or you get a cold, or you get a cough or something that shows that you've actually gone into healing. And I think the big take home from this one is that you don't catch it. You cannot catch a flu, no matter what it's called. You can't catch a cold. It's all a biological reaction to life as perceived by our psyche. And you've got to feel sorry for the poor old psyche, because you know what? It's a prehistoric thing trying to deal with a modern life. And that's why we as a species are the ones that get sick the most, because our poor old psyche is having to deal with what's going on in our minds, which isn't going on in the minds of our pet pooch, And there's a picture of a flu, right? This flu that we're all frightened of catching and we get vaccinated from and such. Well, that's the actual flu there. It's a if you like, an emotional reaction to a life issue mediated through that part of the brain, which is in the underside of the front of the brain. And this is one of the last slides. I just put this in here to show, this is for people with anorexia constellation. So the symptoms of anorexia nervosa. Dr. Hammer's work and the five biological laws apply equally well to psychoses. So diseases of the mind, if you like. And so um, psychoses set in on us when we have conflicts active in both hemispheres of the brain. So if we look at this slide, we can see that on this person here, I'll just draw the round. That's the right temporal lobe of that person, and there's the left temporal lobe of that person. Now, those temporal lobes are depicted here. That, I'm going to draw a line right down the middle here. That's the left half of the brain and the right half of the brain. And we can see that this person has a conflict active in the stomach relay, which will be, I think, fearless anger, which will be a territorial anger, or anger in the territory causes that in lots of people. And they have any conflict active in the same temporal lobe on the opposite side of the brain. So it could be that one, or this one, or this one, or this one. Any one of those active causes or locks a person, or us, you and me, right? It locks us into an anorexia constellation, and we develop anorexia nervosa. And if we resolve these conflicts, whichever one it is, the condition resolves as well, just as quickly. Quite literally, within a conversation, somebody can actually overcome their anorexia or their bulimia or many, many other psychoses of the mind, okay? They can be overcome by resolving the conflicts which are driving them, which to me, it's absolutely amazing. Even though I've been studying this for a long time, when the gravity of these findings it's such a game changer that it just gives us a whole new perspective on ourselves and our lives, and gives us so many possibilities to put things right within us. So the fifth biological law I'm going to really go over again is that every so-called disease is part of a significant biological special program of nature, created to assist the organisms, which includes us, during unexpected distress. There's Dr. Hammer. I think that was about 2010. I knew him only, but I used to speak to him on the phone. He was living in Norway when I was trying to help him sort of progress his getting his some book published in English that he was writing, but unfortunately he died in that process, so that didn't come to completion. And I just want to say thank you, Dr. Hammer, and thanks to everyone that's watching here today. That's been a rocket trip through a massive subject, a life-changing subject, which is so profoundly important, but it's definitely worth progressing your learning of this and really starting to look through your G&M eyes, so to speak. And some final questions. How does G&M help us heal? Well, G&M enables us to know how and why our bodies create a symptom. And this helps to address the cause. Okay, like the lady with the alopecia, when she knew what was causing it, she fixed it and she got her hair back. Nice and simple. Interpreting symptoms through the knowledge of German new medicine enables us to identify where we are within the biological process, and also enables us to know what to expect on our journey back to health, because it can be very, very severe. I mean, one example of a healing symptom, would you believe, is a heart attack. So if you know that that's going to be part of your healing symptom, you've got to prepare yourself for that, or you've got to behave appropriately, knowing what's going to be coming your way, right? I mean, that's one of the amazing things about German new medicine. You can actually look at a brain scan, and you could actually look at it and say, to tell a person, right, you're going to have a coronary artery related heart attack over the next 3 or 4 weeks. And that will be true. And if they know what to do about that, there's a very good chance that they're going to survive that. Obviously, it's not the type of news that you want to hear for sure, but it's probably better to know it than not. Anyway, German new medicine, it gives us a compass, allows us to get ourselves out of trouble. The information within German new medicine enables us to make wise decisions that promote successful outcomes with respect to our health. G&M takes the fear out of disease because it gives us the understanding, and through this, it gives us control. These two factors are massively important, especially when we're dealing with what I would call dangerous diseases. And G&M gives us justification to live our lives authentically, which is a huge permission that it gives us. It gives us, if something's making us unhappy, for example, work or something, like try and resolve it, try and find the easiest path through it. But it's okay to make life changes, because usually attached to heavy emotions is a biological process, and you don't really want to be going down the wrong road too long before you put that right. Oh, that's the end. So that's me back, Graham. Do I press stop share now?
Yeah, if you stop share, and then we can just, well, thank you, Rob. That was, I mean, every time I listen to you, I learn so much, and I'm just, I was trying to keep my jaw from hitting the floor a few times, but
Yeah.
I've just got a few questions which I can ask, and I know there'll be loads more. So for those of you watching, please fire your questions in, and because I doubt this will be our last conversation. I think there's lots more we can unpack. But the bit I really loved at the end, I mean, I know the fear, the fear is huge in allopathic medicine. And the fear of your own body, the fear of symptoms, the fear, or even of the fear of the doctor, and it's almost like the system runs on fear, isn't it? So this empowers people to take the fear away, which is enormous. And the other thing I loved was allows us to lead our authentic life.
Mm-hmm.
Because I know from myself, I knew I wasn't living my authentic life, and when I started living my authentic life, I started feeling a lot better, and my symptoms started going away. So I think for many of us, just giving us the permission to be us,
Mm-hmm.
and and be in control of our lives, that's huge, isn't it? So thank you for enlightening us. So I've got so the three embryonic stem, different types of cells,
Yeah.
that really is wonderful. So the bit I don't understand is what determines which part of the brain is selected by the psyche to run a program of dealing with a conflict. Is that an active choice? Is it predetermined, or does it depend, or
That's the psyche. The psyche determines in the instant of the trauma which it's like the theme of the trauma determines where the psyche processes it.
Mhm.
Um, Another way of, and I find this a really helpful way of understanding it, is that instead of thinking that we have a psyche, it's like every brain relay, which is connected to every single part of the body. So every brain relay has got its own psyche, and it's pricking its ears up and it's looking out 24/7. And when we suffer a trauma, it's the psyche, each of those psyches is programmed with a certain type of trauma that it's looking out for. So the brainstem traumas is, for example, a morsel trauma, an indigestible morsel trauma. So all the little psyches that are coming out of the brainstem, in each relay of the brainstem, they're looking out for an indigestible morsel trauma. So when we, like stroll our way through lives, and all of a sudden we get hit with a big trauma, and if it's an indigestible morsel type trauma, the only parts of the psyche which can resonate with that are the ones that are tuned into that type of trauma.
Yeah.
Whereas the neocortex is separation issues primarily. So, and they're more complex. They involve more than just one person. It's like interdependence of of pack and our groups and our families.
Mm.
And these psyches are all sitting with ready to respond to that type of trauma.
Yeah.
So we don't just have one psyche, if you like, we have a psyche attached to every part of our body, and it responds appropriately.
Thank you. So it's interesting you said it that the individual parts of our brain tune in, and I just wonder
Yeah.
is frequency, is vibration an issue here? Is it, you know, because if we're living in fear, our vibration, often people say our frequency is low, so diseases can manifest more easily if we're living in fear than if we're living in joy.
Yeah, that is incredibly true and very, very important. Because the psyche, the psyche steps in to create a biological adaptive process to help us when we can't cope consciously, right? That's what Dr. Hammer says, and it's so true. So the more we're stretched, Graham, right? The more we are under pressure, the more that we're like desperate and we're worried,
Hmm.
the more closer to the edge of not being able to cope,
Hmm.
the very much quicker the psyche comes and steps forward. And
Yeah,
that's why, for example, if you get a diagnosis of something that you don't like, you think, oh my God, that sounds pretty horrific. I've got there. Where did that come out of? That's put massive stress on you already.
yeah,
And then these people are very vulnerable. Do you know what I mean? Then
mm,
we get fearful of our own bodies,
yeah,
thinking, oh my God, what's it going to do next? And it just, everything's in that kind of situation snowball really quickly.
yeah.
But if you know German new medicine and you know the five biological laws,
Mhm.
that doesn't happen.
No, no.
You just get the diagnosis shock and you think, oh, right, when did that start? Okay, what the heck caused that? Oh, yeah, that's what it'll be. Right, let's go and fix that. And
Yeah,
that's the process you go through, you know?
yeah.
It's
It's
such a powerful, yeah,
Yeah, I mean it's interesting you say diagnosis shock because I was I just as a slight aside, but it's interesting to the conversation. I occasionally I go and look up how did a word, come to be, and the word
okay,
diagnosis, so it's die, which is two, and agnosis is not understanding or not being aware of the root cause. So diagnosis is essentially two people coming together who are blind to the root cause or don't want to deal with the root cause. So when you go and see your doctor and they said they've diagnosed you, you need to walk away. Yeah,
yeah. Neither of us knew what you're talking about. Fair enough.
yeah, exactly. So
Well,
that's
let's say
wonderful.
no more.
Yeah, say no more. And
Say no more about
the what one of the jaw drop moments for me was the ovarian cyst and the nine.
that.
You said all cysts persist for 9 months. Now that
Yeah,
surely is not a coincidence. That has to be related to, the female body
yeah,
creating new life.
yeah,
Is it as simple as the psyche saying, well, we need a little child to help us recover from this injury, so we're going to grow
yeah.
a little child inside us. Is that what's going on?
That's right. And it's the same with ovarian, testicular cysts, adrenal cysts. You know, they're the
Right.
same. The body, basically, the psyche says you're going to need more of that gland because it's really
Mm,
going to help you because it
mm,
knows that from the prehistoric world. That's
mm.
really going to help you with a bit more ovary or a bit more adrenal.
Yeah.
So let's have a little baby. Let's have a little baby ovary get going
Right.
here. And then at 9 months, it'll be a little wee thing and it'll come out fighting. And you'll have that woman she'll look 5 years younger and she'll feel great and she'll be full of estrogen and much more fertile because of it.
It's astonishing, isn't it? Um,
It's a different way of looking at it, isn't it? You know,
it
it's a
certainly
much
is.
more
Yeah.
optimistic way of looking at your health rather than getting a diagnosis and going out and causing yourself lung cancer because you think you're going to die. You know what I
Yeah.
mean? It's
Yeah,
a
absolutely.
it's a big difference, you know.
And then the last, the bit I'd like to end on, I think, because I listen to lots of podcasts and I've heard a bit of criticism of German new medicine out there over the last, not related to our conversation, but it exists. And a couple of things that you talked about, and I think you mentioned it in the first talk, was that German new medicine is an art, and in order to, it's So you talked about the anorexia constellation. So it's the two processes coming together, and you also the example of gout, which I understand from a pharmaceutical point of view. Everything you said made sense to me in terms of the uric acid not
Okay.
clearing it, etc. But in both those cases, you've got the body or the psyche running two healing
Mhm,
processes or two trauma
mhm,
reaction processes at the same time. So that to me speaks volumes in terms of we if we're going to understand new medicine, we need somebody such as yourself who's really, really deeply understanding this to
mhm.
interpret the more complex symptoms. Because
Yeah,
otherwise, because the
yeah.
criticism I've heard is very black and white. It's well, this person had this symptom and German medicine said that and it was wrong. And I think, could it be that the person practicing the Germany medicine wasn't as
Mhm.
skilled an artist as you, Rob?
Yeah, it takes a lot of learning. The first stage of learning is just the understanding the sort of the mechanics of it. But then
Mm,
you suddenly realize when you're working with people that you've then got to find the emotional conflict within the person, which has caused that biological conflict.
mm,
Because conflicts are not simple. I mean, in one way you can say they're simple, but it's like there's something in us that there's some, I feel like a weakness or a lacking or something that we might have done, felt that we've blamed ourselves in some way within us that has enabled the psyche to come in and say, okay, well, I'll start this biological conflict to help you overcome that self conflict.
yeah.
And so the biological conflict which Dr. Hammer gives are on the biological side of that equation. They're pretty straightforward. You know what? It's a morsel conflict. If
Mhm,
you've got if
mm,
you've got Crohn's disease, you've got a morsel conflict running, probably indigestible anger. But it's when you start getting back into, okay, so you know roughly when it was caused, but then what in you, what part of you created that trauma within yourself?
yeah.
That's when you get the big release. That's when
Yeah.
you get the big emotional catharsis. That's when all of a sudden they go into complete healing and okay, they go through a week of hell, but at the end of that week of diarrhea and headaches and such, their Crohn's disease is a thing of the past. They no longer have it.
Yeah.
And that I must admit, it's not guaranteed because it's hard to look inside somebody else's mind. You know what I
Mm,
mean? I can help people the best I can, and I
mm.
am I am good at it, and it comes with practice and a lot of thought. But there's no guarantee. I'm afraid, Graham. You know that yourself.
Absolutely. Well, I think, yeah, I mean, the healing is within us, isn't it, Rob? And I think
Yeah.
one of the revelations for me in recent years is that many people are looking outside of themselves for the solution, for the healer, for the
Mhm.
treatment. And actually, when you submit to actually owning your own healing and realizing that the healing comes from within you, that is probably the first step on your path to healing, isn't it? Uh,
Yeah, it's massive. It's a full wake up call. It's when we actually do that, a whole new a whole new panorama opens up.
mm,
And it's one that is factually true that you can trust. It's not a
yeah,
case of belief.
yeah,
Your body will behave under the control of these five biological laws, and then as a person who understands them, you can manage your own recovery and help your friends and family too, which because this information is so needed. I mean, at this time in society, it's one of the most important things that mankind needs to understand about itself.
yeah. Beautifully put. So I think it was Hippocrates himself who said the best medicine is teaching you not to need the medicine.
Right. Okay. Know thyself.
Know thyself, absolutely. Right, well, absolutely fabulous, amazing stuff, Rob. I'm so delighted we've had this conversation and looking forward to the reactions from the community. So thank you once again so much for joining us,
Yeah.
giving us your expertise. Yeah, and we look forward to having another chat soon.
Yeah, I hope so, Graham. It's brilliant. I love everything the PHA is doing and that you're doing, and I think it's all for the greater good. I'm proud to be part of it.
Wonderful. Right. Thank you all. We'll see you again soon.
Bye.